Welcome back, everyone. Okay, we're past the hoopla and excitement of the first few weeks of school. Now that that's worn off, more children are complaining they don't want to go. For some, the anxiety of going, though, can become serious. And today, we're learning how to tell the difference between not wanting to go and having anxieties about going to school from child psychiatrist Dr. Tanya Feinberg. Good to see you. Thanks for coming on.
Thank you.
All right, I think this is an important topic because a lot of kids are like, I don't want to go. Some kids, though, it's serious. So what exactly is school phobia or school avoidance?
School phobia is when a child refuses to go to school or avoids going to school for reasons that are psychological, such as severe anxiety, or also they might be environmental reasons, such as they're being bullied.
Okay, now how do you know? What are some signs that I can look for as a parent that shows me this is more than just I don't feel like going to school?
Well, the child frequently is asking to miss school and making excuses for missing school. At home, they might become more quiet and withdrawn, less social with friends. You might notice changes in eating and sleeping habits, and you also might notice increased physical complaints. The most common ones that we hear about are stomach aches and headaches.
Okay, and do you think they're really having stomach aches and headaches?
In a lot of cases, they are from anxiety.
They're making themselves,
they're making themselves sick. So it's not an excuse. They're not using it as an excuse. They truly are getting physically ill.
Now, you talked about some of the causes being maybe they're getting bullied or something like that. What are some other causes of school phobia?
So, well, the anxiety is probably the most common one I see. Kids with panic attacks and social anxiety. Also, a lot of kids are depressed. Kids, again, the bullying, as we mentioned before, or there just might be a lot of friend drama, and they might be affected by that. Or they could be really struggling academically due to undiagnosed learning disorders or attention deficit disorder.
Now, what age does this happen?
It happens at all ages. I have patients, young elementary school patients, you know, maybe I have a second grade patient who has suffered from this, and then I have quite a few middle school and some high school students. So it goes the whole range.
Now, how do you really tell, you know, really fast, okay, this isn't just someone who doesn't feel like going to school. This is true anxiety.
If you're in the situation, it's pretty clear that this is not just, oh, I don't want to go. Parents who consider themselves really good, competent parents are just desperate because they cannot get their child out the door in the morning, or they cannot force their child on the school grounds.
They're doing tantrums,
they're crying, they're tantruming, they're often, I mean, I hate to say this, but a lot of children have, you know, get to the point where they say, I'd rather die than go to school.
Wow.
And they mean it.
That's scary and so sad. I mean, as a parent, that's got to be devastating. So how can you help them? What can you do now?
Yeah. Well, immediately get involved with the school early. Get a team approach. They are going to be able to help you. Talk to the teachers, talk to the school counselor, coaches, people who know, might be able to shed some light on what's going on. And then sit your child down, and maybe they've been too embarrassed to tell you what's going on, or feel they can handle it on their own, but really sit down and find out from them what's going on.
And really talk to them. And
Yes.
Then how do you go to the next step, or how do you know it's time to go to the next step and say, okay, my child might need some professional help?
Well, when it gets really debilitating and you get to a point where the child can't even be on the school grounds without having a severe panic attack or tantrum. I mean, just when it's causing major stress and debilitation in their life.
But they can recover.
Absolutely. They can recover with the right help. Therapy and various types of help, yes.
All right. Well, thanks so much for shedding light on this situation. For more information, you can go to drfeinbergmd.com or just call the number on your screen.